My name is David Duffy. I'm a retired physician. This is a continuation of our series of healing thoughts. We're going to talk about pain today. Several winters ago, I slipped on the ice and my foot was bent severely under the car, slipping, trying to get in the car, and I broke my leg. There was immediate pain. There was kind of a feeling of faintness. I was able to get to a place where I could rest inside, and I observed what happened. There was immediate swelling of the ankle and the leg all the way up to the knee. The X-ray showed a slight non-displaced fracture in the tibia. No. And eventually it healed. Now, when a person is injured like that, there is pain which indicates a reaction to an injury. And what happens is that the damaged tissue activates the immune system to repair the damage. There is a signal called inflammation, where the blood cells come through, the blood vessels open up, and fluid pours out into the area of injury. Among the cells that come will be cells that make collagen to repair tissue and form a scar. In a case of a bone fracture, there's an activation of cells to make cartilage and bone to repair the fracture. In this case, it was not displaced. It did not require surgery, but it took its course. Now, naturally, if I tried to walk immediately, it hurt. If I lay down and put my leg up and was quiet, it didn't hurt. In that whole fracture, I never took any pain medicine. Now, obviously, if you have excruciating pain, there's pain medicine available. The narcotic pain medicine is very strong and can relieve a lot of pain. But the usual pain medicine are the kind like Motrin or Aleve, naproxen, and those relieve pain by reducing inflammation. Now, if you were in an automobile accident and you called 911, immediately they would dispatch the police, an ambulance, and a tow truck. And you would want those sources of help to come through. When we take anti-inflammatory medicine to block inflammation, it's like calling 911 and setting up a roadblock so that the help does not arrive. You're inhibiting the help from coming. And therefore, you are opposing the inflammation process. You are blocking the repair process. And in our modern life, we're told, oh, you're exercising, you should not have pain, keep going, take Advil, take Motrin, whatever it is, that pain is not good and pain has to be suppressed so that you can continue to do what you want to do. That is not true. That is really bad advice. We are pretending that we're well by suppressing the symptoms, our body crying for help. The body, if you have a crime scene, the body that you put tape around it and wall off the area of concern, and your body does the same thing. It has the area of healing and it focuses on, and that becomes delicate. One of the major points of this is that when we have pain, your body's asking for help, and we should allow the healing to occur as best we can. And that means stop. So we want to allow it to heal. Pain is our friend. Pain is communication. Let's take some other kinds of pain besides acute injury. A person is in the middle age, they're a little overweight, and their pelvis tilts forward. They tip forward with their tummy. And when they do that, the back, the lumbar region, has to bend to compensate. So you bend forward and then you kind of bend back to stand up straight. That puts tremendous pressure on the lower back, which can lead to a slipped disc. It can lead to bone formation in that area where the bone rubs and thickens, and the bone presses on the nerves and causes back pain. When the nerves are pressed, the pain can go down into the foot. The cause of pain is in the back, but the feeling of pain is in the foot because the nerves to the foot have been injured. Okay? Now, when we have chronic pain like that, and your body continuously asks for help, you can say, shut up, and suppress it with medication, or you can take steps to correct that. In the case of low back pain that does not require surgery, we want to lose 50 pounds, improve our posture, stand up straight, and take that pressure off the back. If the pain is chronic and that doesn't help, obviously, proper surgery and treatment like that can help. Another kind of pain is referred pain. What happens when you have heart disease and the circulation to the heart is less than is needed? There's narrowing of the blood vessels. You exercise and the heart has to pump harder. It needs more blood. It can't get that blood, and you get pain. In a severe case, when a clot forms, you can get a heart attack, a myocardial infarction. The pain from the pain fibers from the heart goes up into your head, but your body feels pain in your left arm. Why? Because the nerves that go to the arm also go to the heart. And so your body, when the body gets that signal, it thinks more of your shoulder because that's the major anatomy of the nerves going down. Okay. So that's another form of pain. And in modern medicine, we kind of recognize different patterns like that. Now, people get a stomach ache, indigestion, things like that. People who are hypochondriacs take every little pain as an excuse to go see the doctor and get attention. And we don't want to do that. But modern medicine does not like to take little symptoms and deal with it. If you go to the doctor and he does his tests and he finds anything wrong, oh, that's nothing, it's in your head. I would say that we should take symptoms, whatever the symptoms, seriously and try to figure out what the body needs, what the body is asking for. There was a lady from South America, and she came to New York and was working as a social worker in a hospital. When she was, I guess, and it was Ecuador, she would have her fruit in the morning and have her normal meals and was fine. But when she came to New York and her schedule speeded up and she didn't take her normal breakfast, but had her donut and coffee or whatever in a hurry, she was fine at first, but over time, she started getting pain. What was happening is that the acid in her stomach was causing inflammation and the beginning of an ulcer. She went to the doctor. The diagnosis was positive. She was given medicine to suppress the acid, but she didn't get better until she said, whoa, I need to go back to what was working before. When she resumed her normal diet from Ecuador, everything straightened out. Why? Because when we have foods that stimulate acid for digestion, and we don't have the roughage and the fiber and the liquids and stuff, our body, our digestion is distorted, and we overproduce acid. And particularly if you take medicine like aspirin or Motrin, it suppresses the repair of the stomach, and you get gastritis and ulcer. So it would be better to take the symptom, the earliest symptom, and first check and see what we are doing that we could correct and try to repair itself. Restore the balance, eat properly, get your rest, stop pushing yourself beyond your limits. On the other hand, if it persists, obviously you would go to the doctor and have further evaluations. But even if we have, quote, nothing wrong, we should listen to our body. Let's take an example of migraine headaches. People with migraines it runs in the family. People have genetic dispositions to it. There are modern medicines that can do whatever it takes to suppress the reaction and relieve the symptoms, but the person continues to have migraines. A migraine headache has throbbing pain. Sometimes you have symptoms beforehand, like visual distortions and things like that. And the body wants to be quiet and go into the dark and just stop everything. When this happens, and we ask why, it's similar to when your computer is going to have an update and it gives you a warning, it's going to close down. And if you ignore it, all of a sudden it shuts down and downloads the new system. I think of a migraine headache like a weather map of the United States. And you see the snow coming in from the Rockies across the Midwest, and now it's going to hit New York or whatever. And you have to kind of stop everything and let the snowstorm or thunderstorm or tornado pass. So when the body declares a migraine and we go through it and minimize it with the medication, it's still not correcting the situation. Why did it do that? What is the point? And frankly speaking, they don't know exactly. They say it's a dysfunction of some system in the brain, but there are many factors that are in the bloodstream and in our personality, in our lifestyle that can be causing this. So in more recent management of migraines, they look for factors that trigger it. Lack of sleep, certain foods, things like that. Now, if a person has a migraine situation and is going along with headaches, a couple times a month or whatever, it would be good to stop everything and kind of try to alter the lifestyle to eliminate these factors that are triggering it. Now it's sort of like a detective work, but it's what we call macroscopic. It's not like a fingerprint and a particular clue or a blood stain or something like that. We're looking at your whole pattern and what's going on. And that's a time to do a general cleanup of everything because you don't know what the factor is. It's a time to have a cleansing diet like we discussed last time. It's time to perhaps cut down on the meat and the fried foods and cut out the junk foods and kind of have a week of kind of more fruits and vegetables and salad and kind of just let your body rest and clean out. And in my experience, when people over time continue to improve their diet and put it more in keeping with their physiology, the migraines will be reduced and perhaps even cured. we're in a situation where you as an individual have your own pattern. And you might be in a situation where nothing bothers you. And you keep going, and you do things that are not too smart, but yet you get away with. Then you are waiting for an accident to happen, and boom, then it happens. We don't want to do that. We don't want to have a heart attack and break a leg and have a bleeding ulcer and get a pinched nerve and get paralyzed in the back. We want to beforehand do our best to prevent that. There's one last point we're going to make, and that is another nature of pain. Let's say you had a back injury or a leg injury or something many years ago, and you notice that when it's going to rain, it hurts, and particularly if you get under stress, it hurts. Why? Because an injured part of the body is sensitive. And when it still remembers and wants to protect itself. So when we're under stress and not getting enough sleep and doing all these kind of things, and the tension in our body goes up, and the nervous system is stimulated with anxiety and depression and things like that, the area of injury gets that increased wave of nerve energy and cries out. That's the weak spot that cries out and has the pain. And in those situations, we need to thank that nerve for reminding it. That's the speed limit detector. That's the thing that's saying, whoa, stop, you're going over, you're going too fast. And instead of cursing the pain, taking medicine to suppress it and ignoring it, we want to not only physically improve there, but we need to do that psychologically, spiritually. We need to accept ourselves and live within our limits and say, hey, okay, I can't go faster than that. I need this much sleep. I shouldn't eat too much this or that. And when you do that, you are going to be in tune with your body, and you're going to be able to be reminded of your limits and do better. We want to calibrate your alarm system so that you can appreciate your body, aim for the ideal as best the metabolism that you can have, and be able to function in ways that are safe and healthy rather than push yourself to continue the way you were 20 years ago and wear out your body in a foolish way. Okay, so between now and next time, think about your experiences with pain and what you learned from them when trying not to take pain medicine if it's not absolutely necessary, and then kind of mapping out your pain alarm system in your body.